me elaborate on that a little bit. The two speakers that we have are Dr. Jane Tobias and Dr. Wendy Ross. Jane is an assistant professor in the College of Nursing at Thomas Jefferson University. She's a pediatric nurse practitioner in primary care and supports interprofessional collaboration education. She recently completed a one-year fellowship with the Golisano Institute in Developmental Disabilities Nursing, which goes by the acronym GIDN. And Jane and I were talking earlier, what we're trying to do is to encourage some other folks to apply for this, because it is an incredible opportunity for individuals who are interested in IDD. The second speaker is Dr. Wendy Ross, who is a developmental pediatrician who is a leader in the field of developmental and behavioral pediatrics. She is the director of Jefferson Center for Autism and Neurodiversity at Thomas Jefferson University and the Jefferson Health System. Just an additional piece of information, Dr. Ross and Tobias are doctors. Ross and Tobias are co-authors on an article published in March 2021. They're part of a team that published an article in the New England Journal in which they reported that having an intellectual disability is the strongest independent risk factor for a COVID-19 diagnosis among a large patient population, which is really an important point. Their presentation today is titled Beyond Access and Inclusion, Belonging in Healthcare for a Population with Intellectual and Developmental Disability. So I'm turning it over to you now, Jane and Wendy, and you can take as much time as you like.
All right. Thank you, Dr. Smeltzer. Yes, okay. There we go. Getting it in. There we go. Now we're in slide mode. Hopefully everybody can see this. First of all, thank you very much for inviting both Dr. Ross and myself today to come and present on a topic that's very near and dear to our heart, and obviously your hearts as well. As Dr. Smeltzer said, I just completed my fellowship at GIDN, and this presentation is centered around some of the work I did during my one-year project with the fellowship. Dr. Ross is director of the Center for Autism and Neurodiversity, where I spend a lot of my time when I'm not teaching in the College of Nursing at Jefferson. And really to say that she is a force to be reckoned with at Jefferson and outside of Jefferson wouldn't really do her justice. She's been a wonderful mentor to me within this area, both of nursing and healthcare. And you will see just as we move through our presentation that our program is a little different. It's a little unique. It focuses on many, many aspects of the environment, and we're going to share some of that with you. We're going to talk about our process by which we set up programs. Again, some of the challenges we encounter, but many, many of the successes that we've had, and hopefully creating a culture shift at Jefferson Health and beyond it. So I am going to get started. Now, who are we? And I wanted just to kind of set the stage for everybody. Not everybody's located in Philadelphia on the East Coast. So Dr. Ross and I work at Jefferson Health System, and it's unique in that it is both an academic institution. It is a huge health system with approximately 18 to 20 different hospitals and centers in Pennsylvania as well as New Jersey. And within the health system, there's two programs really which we are very active in. Obviously, the Center for Autism and Neurodiversity, where Dr. Ross is the director. And our center is a programmatic center, meaning that we don't see patients, provide clinical care. What we really want to do is apply design and strategies to the environment around us to make a more inclusive and sense of belonging area for our patients and for their families. The other program which we have at Jefferson is the Jefferson Continuing Care Program. Now, the Continuing Care Program is our medical counterpart. It is a program in which Dr. Mary Stevens runs, and it sees patients from age 12 across the lifespan. So in my pediatric hat, when I was practicing clinically, a lot of my patients were transitioned to Dr. Stevens. Her population focuses on those with intellectual and developmental disability, complex health problems. And again, I think what makes her practice so unique is she also takes care of the families, because we know a lot of caregivers don't dedicate any time to maintaining their own health and taking care of themselves. So this program is embedded in family medicine. And when she is seeing her patients, the caregivers, the parents can also get their health care needs addressed. So when I started this project a year ago, I did a review of the literature as well as taking just a look around the health system in which I was working, and found that there were many barriers and gaps in accessing healthcare for those with IDD, and decided to focus on 3 aspects that I felt I would be able to make an impact in, both as a clinical person, but also as a nurse and an educator. So what we found at Jefferson, and again in the literature, is there's a huge void of education and formal training for healthcare providers and also patient-facing personnel. As you'll see, many of the programs that we've developed and implemented focus on the healthcare provider, focus on OT, PT, but also that person at the front desk that's checking patients in, our security team at Jefferson Health, our human resources department. And also on the university side, we're starting to work with faculty in helping them identify students that are neurodiverse and support them in their educational experience at the university. We found that there's many ineffective communication pathways between providers and patients, and we're working right now on developing a health passport at Jefferson Health, as well as refining and mainstreaming many of the processes by which our patients have to navigate that can be frustrating, and that can also provide or create a barrier when they're trying to get their appointments or when they needed their COVID-19 vaccine. And then lastly, and this really came out of Dr. Lisa Iazzoni's article that was published in 2021, there's a huge bias towards the IDD community. And for me, when I read this article, this was really kind of that, gut punch that said, wow, we have providers out there that are admitting to having a bias, but almost 40% are saying they don't even feel confident in providing care. And that number was staggering. I greatly appreciated the honesty of those that participated in this survey, but to see those numbers in writing and know that our patients are, already facing challenges, and now when they go to see their provider, somebody that they place all their trust in, that provider may not be comfortable in providing care. So again, that was a big push for me, particularly in the education department within our setting. Now, the aim of the project is, pretty broad. I wanted to create a friendly healthcare, academic healthcare setting for the IDD population. I wanted every patient that came to our campus that received care from a Jefferson provider, whether it was their medical care, OT, PT, speech, they're trying to make an appointment, they're having a radiologic study, to feel included, but more than that, to feel like they belong there and that we are adapting to their needs and they're not constantly having to adapt to our needs. So with that being said, my areas of focus were on addressing those gaps in healthcare provider and healthcare professional knowledge as it related to caring for individuals with IDD and or neurodiversity. Our center is very broad in terms of, we really look at the whole neurodiverse population, which obviously includes autism, IDD, those with anxiety and such. We wanted to start integrating IDD and neurodiverse focused education into nursing curriculum, medical curriculum, and we have a very large health professionals program at the university and infusing it into their curriculum as well. And then lastly, what makes Thomas Jefferson University unique is about 5 years ago, it merged with a college, Philadelphia College of Textiles. which is fashion, it's engineering, it's design, it's the built environment. And that was right up our alley in terms of IDD and neurodiverse care. So we are working with a lot of different disciplines, which we'll talk about in a moment, in just creating new systems and pathways and processes so that we provide better inclusion and access to healthcare. The objectives of my project were to align, obviously, the priorities of individuals with IDD and their families and caregivers to the mission and the vision of Thomas Jefferson. And our mission is to improve lives, and our vision is reimagining that in new and innovative and creative ways. So with that being said, and having Dr. Ross leading our charge at the Center for Autism and Neurodiversity, we have a lot of fun being innovative. We have a lot of fun being creative, which we'll talk about in a moment. And it really is about crossing disciplines and really opening that door, welcoming everybody from the university and the health system that has an interest in playing in our sandbox and helping us develop these programs. I also wanted to increase knowledge and comfort level of our healthcare providers and our patient-facing staff, and we've done that through a lot of focus groups, and we developed standardized patient simulations. And then lastly, and I think most importantly, is to foster that healthcare environment in terms of inclusion and belonging in Jefferson Health and outside of it. So our project design is interdisciplinary. We do nothing just with ourselves. We have such a huge interdisciplinary network that we work alongside of. And I think that's really what makes this a joy and a pleasure. And first and foremost, with everything we do, the first person at the table with us is those with IDD, with autism, with neurodiversity, informing us every step of the way. What is it they need? It's not about what we want for them, it's what they need from us. And we're nurses, I'm a nurse, so we always have to have that theoretical framework that guides us. And I use two of them along the way, the Iowa Implementation Sustainability Framework, which actually is very similar to Cotter's change model. And the key here is sustainability. Whatever we do, we want to change the culture. And after we're long gone, the people coming in behind us, we want them to just be able to carry the torch and make it better and go forward. So again, we're looking at sustainability in our programs. And now I'm going to ask Dr. Ross to speak a little bit about what is it about our programs? How do we get them up and running? What is our process that gets us across the finish line with this?
Thank you, Jane. I just have to throw in there that Jane is amazing to work with and just an asset to any program. We'll talk more about that later. So anyway, when you look at this diagram, if you go to the bottom left, the first thing we do, as Jane mentioned, is we ask the perspective of the people that we're hoping to serve. And, that's the neurodiverse population, the population affected by international, with developmental disorders, intellectual and developmental disorders or disabilities, or even just challenges. We always start with that population first, because as Jane so eloquently mentioned, it's not about what we want for people, but it's what they want for themselves that matters the most to us. And then we also take the perspectives of people from an interdisciplinary perspective. So, and as Jane said, we are big fans of having fun, but this is where we ourselves also get to have fun and get to learn so much. We work with occupational therapists, nurses, doctors, art therapists, industrial designers, architects, students at all levels. And so that's really helpful, because we all sort of have a similar vision, but we're using different lenses to see it. And so we share our lenses with each other. So it really all starts with that. And then, the next part is we really think about education and not just education, but resources. And frequently in the world of intellectual and developmental disorders, or even any neurodiversity, or especially an invisible challenge, sort of the burden is on the person or the individual to sort of overcome whatever barriers are in the community to them. And that's not something we see for people with physical disabilities, right? Like, you would never consider putting somebody in a wheelchair in a community without ramps. and feel like you've done anything, but that happens to our people all the time. So one of the huge areas that we try to impact is sort of the community, to sort of create those ramps. And the ramps are not physical ramps, but they're ramps of education, strategies, toolkits, and most of all, sort of like a mindset or a sensitivity or an openness. I don't know how many of you have seen the show Ted Lasso, where he quotes Walt Whitman, who says, be curious, not judgmental. Sometimes when somebody looks typical but behaves unusually, we tend to judge as a society. So I think, to really change that perspective is important. So we educate, but our education starts in the community for that reason. But we also do educate and create resources for our population. And we try to make sure those resources are accessible both online and for people who cannot get online in other low tech ways. So tips and strategies, visual stories, visual schedules, all of that, we try to make it bi-directional, having those resources in education. And then, if you look at the top of the diagram, you'll see it says processes and programs, because, you don't learn to drive a car by just reading the manual, right? Like sometimes you need to get behind the wheel, you need to get on the road. So for some people, it's not enough to have resources and education in their pockets. They need to sort of have a dry run, right? I mean, how many times have you needed that? So we create sort of practice programs or instill processes. Jane mentioned the continuing care program, and sometimes when people transition from pediatric to adult medicine care, we do what's called a warm handoff. Sometimes their current clinician may actually go to the first appointment with them or Zoom in, or they might come and just sort of check out the site before their appointment. Regardless of what that is, we have pathways to help facilitate a successful experience, right? And then, we always try to measure outcomes. We feel pretty strongly outcomes matter, because we want to know that we're creating a good, what we're doing is succeeding in what we are hoping it will do, right? Like we're not here to just sort of stroke our own egos. We want to make sure that what we're doing is a good practice. And outcomes are also really important, because once we find that good practice, we want to use it to drive policy or to advocate. And that's another reason to have really good outcomes. When we think about the Americans with Disabilities Act, it of course applies to neurodiversity, yet there are really no clear guidelines like there are for physical disability, right? Like ramps have to be a certain width, they have to be a certain incline, but there's no such guidelines. And sadly, like the way the ADA works is that you're forced to be compliant, right? But if there are no guidelines, there's no benchmarks for compliance. So it's much harder to ensure the accessibility opportunities, right? So, we want to create those ramps. We want to make sure the ramps are set up in a way that's functional. And then we want to build capacity. And in order to do that, we need to use those outcomes to drive policy. And that's super important for us. And, we'll give an example of that later. The other thing I want to mention, since we're talking about ramps, is that, ramps were created for wheelchairs, but they benefit other people with mobility challenges, right? Like crutches, knee scooters, strollers, delivery people. So the pathways and the strategies and the resources that we're creating for the population with IDD and neurodiversity are designed for them, but they really help all of us. I mean, there's really not any of us that will at some point in our lives not be in some way, either transiently or permanently, have some state of neurodiversity, right? Whether it be we get a diagnosis and it makes us really anxious or not processing quickly or communicating effectively. So, we're designing for one population, but we feel strongly that, opening that door really opens it for so many people who may or may not even be aware that they needed it, right? We're big fans of the built environment. And as Jane was saying, we're super lucky to have Jefferson University. We have multiple courses at the university now. We have an architecture course on the built environment. We have an industrial design course where we're creating new kinds of seating that are allow people to remain in the room, but are sensory protective. Right now, if you get overwhelmed in a sensory environment, you're kind of sent to a separate room, maybe if you're lucky, right? But those rooms might be juvenile, or they might be, if you're at a stadium, a sports stadium, on the other side of the stadium. And look, they're not a bad idea, but what is a bad idea is that they're the only idea. And when you go into waiting rooms in medical centers, you see those bariatric seats, the ones that are a little wider, for people who need that accommodation, who are bigger. And we feel strongly that there should be seats that are sensory friendly and help our people stay in the world, you know, and not have to go to a room, or even worse, not go at all, right? So the built environment is really important, because that sensory experience can, you know, even before you open the door, let alone cross the threshold, could be an impediment. And then lastly, like, we are really trying to, when you look at those numbers from Lisa Iazoni's study, it's really terrifying that almost 83% of doctors said they think everyone, that was all comers with disabilities, have really poor quality of lives. And the thing that's so fascinating about that number is not only is it really high, but the fact that it's so high means that people thought that was a socially desirable response. They thought that was okay. Because, you know, sometimes you take a survey and you know what you would really do, but you know really what the better choice would be. And there's like a 50-50 shot, right? You might pick the better choice. But in this case, so many people chose that they not only believed that, but they thought, well, of course that makes sense. So those things are really, really concerning and really impact, you know, that's really, you know, this culture shift is really something we're working hard to move the needle on. Next. So we've done some stuff, and I have to say, Jane has been a force of nature on all of our projects. We really couldn't have done most of these without her. We have done grand rounds across multiple subspecialties, and we continue to do that both inpatient and outpatient, to provide, you know, the education, as Jay mentioned, not just our clinical providers, but, you know, the people at the front desk, people making your appointments, people who are taking you back to your room, checking your vital signs, because all those things happen before you see the provider. So we've worked with security. We've worked really hard with our diversity, equity, and inclusion program, because, you know, really what's happening, and this is not to sound at all judgmental, because those programs are amazing and we need them, but they tend to focus on, you know, race, gender, sexuality, and maybe some physical disabilities, but overall really not disability. There was a really interesting study from Harvard that showed that actually progress has been made culturally on racial equity and gender equity. I mean, obviously not as much as needed, but actually that as a society, we have not moved the needle at all on disability. And we keep reminding people that if your diversity doesn't include disability, you're really not doing it, you know, comprehensively. So we work both to create neurodiverse friendly healthcare, and as Jean mentioned, working on this passport, which I'm super excited about, but we're working in the community. So working at the flower show, and we also expand that to other horticultural programs. We really feel like gardening is not just therapeutic, but it also provides a high, you know, a nutritional result in some cases. So that's pretty exciting. We work with corporations, we work with sporting teams, we educate game day staff, we prepare families, we bring them to games, sometimes supported by clinicians or volunteers, sometimes not. I'm leaving tonight to actually speak to advocates for the Pennsylvania Supreme Court, and we've worked with them at an autism summit as they try to expand, especially the dependency courts where kids go through foster care, to be more autism accessible. We work with Special Olympics and with the Autism Society of America. And in fact, I'll talk more about this in a minute, but our neurodiverse friendly vaccination program was adopted by both of those entities, and Special Olympics filmed our participants in our focus group talking about what they wanted in a vaccination program, which is where we started. We started with them. So in terms of the built environment, we have those courses, and Jefferson, you know, they don't just walk the walk, like they talk. I mean, they don't just talk the talk, they walk the walk. And so we've been invited to help consult with our advisory boards and consultants and focus groups on the new specialty care pavilion going up. We're super excited about that. And then we have multiple courses at the university. We've created standardized patients, both nonverbal and verbal, for our medical students and nursing students. This fall, we're having our first fashion course for the neurodiverse. We're having a medical humanities course for nursing and medical students, because we really want, you know, from the beginning of your career for you to have a sensitivity and a fund of knowledge and just some strategies for this population, because it's increasing, and it's really not acceptable to not know anything about it. We're creating that furniture, as I mentioned, and it looks like the Miller Knoll is an international furniture firm. Will be manufacturing one of our first designs. We're really excited about that. We have a course on the art, immersive art, and the healthcare experience, and that's really cool because not only is it ensemble taught, but the students are both graduate and undergraduate health students and design students working together, which is something we also are proponents of, that interdisciplinary perspective going forward in your career with that. We have our architecture course, and every year we have an annual symposium. We have people from the Middle East, Egypt, Israel, Australia. We have people from India, Europe, from all over the United States. So it's really an exciting exchange of ideas. And Jane already talked about the health passport. So next. Here are just some pictures of some of our programming. On the top, you'll see we did a program with the showroom at Subaru. We had a resource fair. To the right, you'll see our work with, that's Justice Doherty, along with our team working with the Supreme Court of Pennsylvania. And then on the bottom is some of our, you see Jane and I are right in the middle there at our horticultural program. So those are just some, you know, we work with the Phillies. We're hoping to work with, when the World Cup comes to the United States, we have some upcoming meetings and we're really excited about. And then we had our neurodiverse friendly vaccination program. So next. Here is Jane being a rock star at our vaccination program. So we did a focus group first, and we asked people what they wanted the people vaccinating them to know. We took their responses, and Special Olympics filmed for us a video, which we won't have time to show you today, but we will give you the link for, that sort of articulates their wish list in a vaccination program. And then we ran our own neurodiverse friendly vaccination program, and there's Jane vaccinating some both willing and unwilling participants who were actually in the end super excited to be vaccinated, but were you know, nervous or afraid. And this isn't the only place where Jane and I were vaccinating. If people could not literally enter the building, we would go out to the parking lot, and we would you know, vaccinate people in their cars and stand beside their cars and wait out their 10-15 minutes, you know, their 15 minutes, and say, sorry, that's awesome that you got all 4 boosters, you know, shots and boosters. Congratulations. So, okay, next. This we're really excited about. We have been consulting on the specialty care pavilion, and by us, I don't just mean us, I mean sort of our team, which is collectively interdisciplinary and also involves those with neurodiversity. This model of our specialty care pavilion was created by an autistic artist named Campbell Smith. He calls himself an autisarian because he feels like there's a lot of stigma of the term autism, actually. So he had many family members that were impacted by cancer. So our new cancer center is in this building. And we will be debuting this model soon. And it will bring home both the idea of neurodiverse cancer care, and also will highlight that, you know, when people think about those with intellectual and disability and developmental challenges or autism, or even if you're an autism, it tends to be a hierarchical one. And so we just love the fact that Campbell both created this sculpture, which I don't know I could never have created, right? And not only did he create this, but he did it without a ruler. So all these measurements that you see that look so beautiful and symmetric are things that he did, you know, in his amazing mind. I couldn't do that with any amount of assistance, help, rulers, whatever. Like it's really a multifaceted message with this model. So next. So Jane, do you want to pick up from here or?
Sure. So these are two videos. Again, they're here to view at a later time because they do take a little bit of time, but it was the work that we did both with Special Olympics and also with CNN on the, I think really the premise of it came from the article that Wendy and I were part of many authors on that identified COVID really being that independent risk factor. And how could we mitigate it in a quick way, in a quick turnaround? And, you know, our first thought was a COVID vaccine center, as you saw pictures of earlier. And it was a wonderful experience, not only because we were getting these adults, these children, these adolescents vaccinated, we were getting their families vaccinated. It just wasn't, you know, bring your son, bring your daughter. It was bring your entire family and we will take care of them. So you are only really making one trip out. You're not having to leave your house. I think that, you know, we look back now and it seems like many years ago, but at that time, nobody wanted to leave their house. It really was quite challenging for a lot of people. And it raised anxiety in a lot of our population as well.
And I just want to say also, you know, when you have an IDD, it's a contextual thing, right? Like your family is heavily involved, you know what I mean? So the fact that it was a contextually provided vaccine was important to us. And the fact that it was on CNN is really important because it goes back to that culture shift.
Yeah. And this was just, again, the article that was really our springboard in not only getting our own vaccine center up and running, but changing policy across, forget how many states, Wendy, and a couple countries in terms of moving the ID population to the top as high risk and getting them the vaccines, you know, sooner rather than later. And again, you know, we look back and there was a time where it was hard to get vaccine. You couldn't come by it easily as it is now. So this was a lot of pride went into this work in setting up these vaccine centers. Again, we went to the CDC with the data from our research in that article and unfortunately couldn't really move the needle at that time, but we were able to move it more recently with the CDC. And on their landing page, as you can see, people with intellectual and developmental disabilities have been identified in that high-risk group and needing COVID vaccines and making it a priority. So lessons learned. I love this little picture that I put here. Wendy shared it with me many, many months ago, and it really, I think, exemplifies our mindset. And that is mastering fire was impossible, flying was impossible, walking on the moon was impossible. Someone will always say it's impossible until it gets done. So who cares if it's impossible? Let's just do it anyway. And that is our mindset at our center and with our team that we work with. We try not to look at obstacles as obstacles, but as opportunities and how are we going to work around them. Some of the lessons I learned over the past year, just in working on these various projects, are it definitely does take a village. We talked about the importance of allyship over the course of the year, and you truly need that. You need to identify who are your champions. And for us, we found champions in the most unlikely places. And that was really awesome to see because we felt like if we can get one person to hear our message and to listen to us, it's going to start to spread and pick up momentum. Persistence and patience, the two Ps. I will tell you, we live by this every day when we're told no, or we get kind of pushed down or to the side with an idea. That's okay. We go back to the drawing board, we regroup, and we try and look at a different way to present our ask and what we're looking for. And then again, it has to be interdisciplinary. And that just, I think, adds to the fun of the work that you're doing. The more different perspectives, the bigger lens that you can look through, you're really going to drive that policy, move that advocacy, and have a home run in the work that you're doing. This was just a little saying that we really think a lot of within our center. And again, it drives us. That diversity is being invited to the party. Inclusion is being asked to dance. But what we really want is belonging. We want a sense of belonging for everybody that we work with in the neurodiverse community and the IDD community. Some limitations and challenges, and of course, you're always going to find them. The COVID-19 pandemic for us, when we were starting out, and we're a young center, we're not even 3 years old yet. So when we were starting out, the pandemic really had just started and kind of didn't halt, because we're not going to be halted, but forced us to slow down and look at different ways to accomplish some of the projects we set out to do. And as a result of that, burnout in our education staff, burnout in our faculty, burnout in our nurses and our healthcare providers and everybody that's patient facing, and how to mitigate that and how not to ask them to take on one more thing when we went in with our training and our education. The size of our organization, obviously, it's a very large organization, but our approach is just to focus on one clinic, one program, one course at a time. The Office of DEI in Jefferson, as Dr. Ross alluded to, is wonderful, and they are doing incredible work, but it really has been persistence that we needed in getting them to finally recognize that disability needs to be part of that equation, and more importantly, invisible disabilities, folks with IDD, ASD, and neurodiversity. We're finally starting to get a little bit of traction. We've been invited to speak a few times at kind of the grand rounds that they hold for the whole healthcare system. So we're taking advantage of it. We're knocking on their door with every new thought and project we come up with. And then obviously funding, I think, which is everybody's challenge, just finding funding to do the work that we want to do. This is Cotter's model, which I alluded to earlier. And again, I just kept this in here. This is from my fellowship presentation, but it really is helpful when we come up with an idea of how to get it started and then how to bring it across the finish line, with that last change agent being making it stick. And I think that's where our persistence and our patience comes in. So pleasant surprises that emerged from the work that we do and continue to do. Again, the emergence of supporters and champions that we never would have thought would be knocking at our door to say, hey, I just heard you speak and I want to start incorporating this into my course load. Or would you mind coming to our clinic and speaking to our staff? We're getting phone calls from charge nurses at the hospital. We just had a patient with IDD admitted, a lot of oncology patients, obviously with the population of Down syndrome and the risk of leukemia, we do see quite a bit of that. And can you help us? How can we make this patient less anxious, feel more comfortable? What suggestions can you give us? We have bags with fidget spinners, headphones, sunglasses for bright lights that we will run over to the floors at our hospitals and drop off for these patients, which have been very helpful. We do have an advisory board at the Center for Autism and Neurodiversity. And on that advisory board, we have folks with IDD, we have parents of children with ASD, we have neurodiverse members, we have interdisciplinary members, and we're continually adding to that advisory board, which has been wonderful. We're having a lot of engagement from our focus group members. They have a lot of fun with the focus groups, and often we'll say, next time you're getting another one together, can you please let us know? We want to come. And once we get back to meeting in person again, I think that we'll even be more successful. We started out with a couple in-person groups before the pandemic hit. We get a lot of feedback from employees, particularly employees that have not disclosed that they're on the spectrum, primarily women who are diagnosed much later in life. because they mask so well, just thanking us for bringing an awareness to the university and to the healthcare system. And then another kind of pleasant surprise was we were finding increased employment opportunities for students and for our IDD community, particularly in the cybersecurity sector at Jefferson. So again, everything we do, we always have a focus. Employment and housing is also part of what we do in our center in our program development. And then lastly, my acknowledgements again to the Golisano Institute of Developmental and Intellectual Nursing faculty. Shirley McMillan was my mentor extraordinaire up in Ontario, and she was just wonderful to work with, as was Dr. Ross, my Philadelphia mentor. The IDD community, as we said multiple times throughout this, they're the first ones at the table, and everything that they tell us, we listen to and we implement. And then again, the Jefferson Center for Autism and Neurodiversity, we're a small group. There's only, I think, 4 or 5 of us right now, and we are growing. We've added a couple more occupational therapists to the mix, as well as another nurse practitioner, but it's a great team to work with. So again, I just want to thank everybody that's here today to hear a little bit about some of the work we're doing down in Philadelphia. And please, if you have any questions, now's your time to ask us about anything that we're doing.